About in our resource about lactic acidosis. So when you say lactic acidosis, what does it sound for you? What does it mean? High lactic and
when loss of oxygen. Lactic acid
يعني بس ناخذ الكلمة lactic acidosis, so high lactate in the bloodstream, and you have acidosis, and I have pH acidic, acidemia. Okay, so this is what it sounds for. In year one, we studied. Can you please focus? In year one, we studied the metabolisms in biochemistry, how the lactate is produced. Okay, anaerobic what?
Glycolysis.
Yes. So the lactate is usually produced by our body. Okay, so we produce it from the glycolysis of the glucose بنحصل الpyruvate, and this pyruvate usually it is processed, converted to acetyl CoA by the Krebs cycle, but sometimes the Krebs cycle is overwhelmed, or when you have anaerobic conditions, so this pyruvate راح يتحول into lactate. Okay, is there another way to have pyruvate? Okay, what else? Yes, which amino acids? No. No. Alanine. You remember the enzyme transaminase alanine aminotransferase? So this amino acids فيه كمان يتحول, and we convert it into pyruvate, and then it can give us into lactate. So lactate, it is produced by our body. Okay, so it's a, we can say, physiological process. So when it becomes pathologic? Okay, so when it overaccumulates and? No, there is two processes يمشوا مع بعض. Yes, so when there is a disturbance between the productions and the excretions, the production exceed the clearance of the body. So at that time, we're going to have a buildup of lactate in our body, and then it can lead to a pathological condition which is called lactic acidosis. So today we're going to talk about lactic acidosis. We're going to introduce what is lactic acid, so you know it already. Then we're going to talk about what are the conditions which are associated with lactic acidosis, how we can diagnose lactic acidosis, and what are the different types of lactic acidosis. Okay? So this is what we said previously. Lactic acids يجي من الpyruvate, من anaerobic, conversion of the pyruvate into lactate, or from the conversion of your alanine into pyruvate. So this is the two pathway. So now we said that our body, it is capable to excrete, to we can say to clean, to metabolize, these lactic acids. So usually all our organs are capable to do that, all right, but by different process. The two main organs which are responsible, we can say, for the clearance, for the metabolisms, it's the liver at the first, we can say, level, and it comes after the kidney. Okay, so liver, how he can process the lactic acids? So by what we call the Cori cycles, and by gluconeogenesis. So lactate بيجي من المسلز راح يروح للليفر، والليفر by gluconeogenesis راح تغيره ويصير جلوكوز، والجلوكوز يرجع للمسلز to be reused. Okay, so this is what we call the Cori cycle between the muscles and the liver. Okay, so there is a gluconeogenesis. This is a way to reduce the level of lactic acids in our body. All right. For the kidney, there is three ways that it can clear your body: gluconeogenesis, excretion in the urine, or just oxidation in CO2 and water. So there is 3 ways. So as I said, all the organs, they are capable to excrete, to metabolize, to oxidize, we can say the lactic acid, but only the liver and the kidney هما اللي قادرين انه يسووا gluconeogenesis. هما القادرين انه they will convert your lactate into glucose because they have the enzymes for gluconeogenesis, and this enzyme they are absent in the other organ. Okay? واضح? All right. So when we say I have lactic acidosis, as we said, when the production with food, excretions, okay, it exceeded the clearance. Usually the reference range is between 0.5 and 1.5 millimole per liter. So هذا عادي. Okay, this is the reference range of your plasma level and lactate or lactic acids. So when you have this serum level exceed 4 millimole per liter, so at this time you can say you have lactic acidosis. Okay, and of course sometimes it is accompanied by a decrease in the pH. We have acidosis. Okay, so this is the conditions to say how you can diagnose. I have a case of lactic acidosis. All right, so the lactic acidosis, as we said, the lactic acid, it is cleared mostly by the kidney and by the liver. So any diseases which can affect the kidney or the liver, شو راح تصير? We're going to have a lactic acidosis. So lactic acidosis can be associated with diseases like liver disease, renal failure, but also there is other diseases like diabetes, ketoacidosis, and this kind of thing. So they can lead to lactic acidosis. Okay, ساعات بيجوكم problems when you have ketoacidosis or diabetic ketoacidosis, and you have also on the same time lactic acidosis in the same time. You can have this kind of SAC, short answer questions. Okay, so there is other conditions or where we can have lactic acidosis اللي هم inborn error of metabolism. Inborn error of metabolism تعرفوا شو هو? You know what is it? Inborn error of metabolism. What is it? Yes. في مشكل في الانزيمز. It's something inborn, something there is a mutation in the gene. So الإنسان لما ينولد already عنده هالmutations. It's inborn. It's not acquired. Acquired بعدين بتصير. Inborn يعني من ينولد عنده هالmutation في هالجين. So يخليه إنه الإنزيم هذا it is deficient. So when you have deficiency in these enzymes, it means there is a pathway which will be impaired. Okay, so one of these enzymes, for example, we have glucose 6-phosphatase. We have, for example, pyruvate carboxylase. So all these, you know, deficiency, they lead to diseases and they will be accompanied by lactic acidosis. Okay? So now we're going to move to talk about what are the different types of lactic acidosis. We have 3 types. Type A, type B, and lactic acidosis. So you have to know that the lactic acids, it exists as stereoisomers, 2 stereoisomers. We have the L-lactate and you have the D-lactate. Okay? So usually the type A with type B is accumulation of L-lactate. For the D, it's accumulation of D. Okay? D-lactate. But the LA will be, they are the more common, we can say lactic acidosis. However, the D-lactic acidosis, it is rare, it is uncommon. Okay? So let's talk about the type A. What are the difference between these different types of lactic acidosis? So the type A, if I tell you type A, you have to tell me it's hypoxia. It's tissue hypoperfusions. Okay, so there is a problem on the oxygenations of the tissue. Okay, so when you have a poor oxygenation, so we're gonna have what we call the type A lactic acidosis. Okay, so this kind of hypoxia be seen, for example, when you have cardiovascular problems, when you have lung problems, when you have, for example, problems, some hemoglobinopathy, okay, something related to hemoglobin. So anything which will lead, you know, to a decrease, we can say, of oxygenation of tissue, it can lead to lactic acidosis type A. Okay, there is also a condition which is called dysoxia. Dysoxia هو إنه there is enough oxygen, but there is inability to use this oxygen. Okay, this is what we call dysoxia. Okay, the hypoxia ما في oxygen enough. Dysoxia there is, but there is an ability to use, you know, this oxygen. Okay. All right. So when we said low oxygen, sometimes people they think about anemia. Anemia, less red blood cells, so less oxygen and so on. Okay? But you have to keep in mind, in anemia itself, it cannot cause lactic acidosis. Okay? It can be, we can say, a risk factor. We can contribute to the lactic acidosis, but itself it cannot create, we can say, the lactic acidosis, unless there is extreme, we can say, anemia, when you have the partial pressure, it is less than 35, while hemoglobin concentration is less than 5 grams per deciliter, which are extreme condition and they are life-threatening. يعني إنسان أقل من 8 already ممكن يموت 8 grams per deciliter. Okay? So this is, we can say, extreme, which can lead by itself to type A lactic acidosis. Is it clear? واضح? Clear there? All right. The second types, which is called type B lactic acidosis, هذايا is not due to hypoxia, but there is a disturbance in the carbohydrate metabolism. That's واحد hypoxia والآخر carbohydrate metabolism. So this type B, it is subdivided in through 3 subtypes. And the B1, B2, will be 3. The B1, it is associated with diseases like ketoacidosis, leukemia, lymphoma, HIV. Okay, so this kind of diseases can lead to lactic acidosis type B. Okay, the type B2, they are associated with drug. And الشخص هذا is consuming a drug. He's consuming, for example, metformin, which is used for the treatment of certain diabetes type 2. People who are sometimes consuming alcohol, they can have lactic acidosis type B2. People who are, you know, using cocaine. So this kind of people, they can have lactic acidosis type B2. Okay, so they are associated with drugs. Okay, the type B3, it is associated with inborn metabolic metabolism, and for example, when you have defect, for example, in the pyruvate dehydrogenase, so when you have an enzyme deficiency in the carbohydrate metabolism, it can lead to B3. Okay, is it clear? All right. Now the type D, as I said previously, it is due to the buildup of D-lactate. Okay, so this D-lactate, as we said, usually الجسم it produce L-lactate. It will not produce D-lactate. So when we're gonna have production of D-lactate, we can see it for people اللي يسويوا bypass surgery عشان يخسوا شوي. Okay, and people who they have short bowel syndromes ولا أشخاص عندهم problem in the GI absorptions. Okay, إذا عندهم مشكلة في الامتصاص مع absorptions. So هذول الأشخاص they have a problem in the absorptions of the carbohydrate. So شو يصير الكربوهيدرات راح تروح للcolon directly because they are not absorbed. راح تروح للcolon, and there the bacteria which are in the colon, they will ferment your carbohydrate ويحولوها into acids بما فيهم الدي-lactic acids. Okay, والدي-lactic acid هذيك after it will goes in the bloodstream and it will increase your level of D-lactic acidosis. Okay, so this is how the D-lactic acid it is produced. It is produced by the bacteria in the colon. Okay, by fermentations. All right, so this is our last slide. Do you have question about lactic acidosis? Is it clear? واضح? You have question about it? Clear? Perfect. So there is another condition which is called hyperlactatemia. Okay? شو الفرق ما بين hyperlactatemia والlactic acidosis? Hyperlactatemia when the level of your lactic acid يكون أكثر من 2 millimole. Lactic acids lactic acidosis لما يكون أكثر من 4. Okay? So this is الفرق ما بين hyperlactatemia والhyperlactatemia أقل life threatening than the lactic acidosis. لأنه it happens as is written here ينجم يكون we have normal tissue perfusions, we can have normal buffering system, normal tissue oxygenation, لكن موجود hyperlactatemia. It can happen. So there is also hyperlactatemia. It can happen when you have liver diseases. Okay, sometimes we can have hyperlactatemia associated with disease, and mostly for the liver disease. دايما keep in mind الليفر هو the organ of clearance. Okay, so أي شيء which can affect your liver, so you're gonna have a build-up of the lactic acid. So that's why sometimes lactic acids, it can be a prognostic factor for the liver disease. Okay, يعني فيك تستعملوه إنه يكون في خلل، بيكون كل شيء oxygenation عادي وكل شيء، بس في something يعني في hyperlactatemia. So this we need to think about liver, okay, as a diagnostic tool. All right? Is it clear? Do you have questions? Okay, بشوفكم tomorrow حق اللاب. Okay?